Good morning and welcome back. Today we have Dr. Paul Dale from Atrium Health Navicent joining us. Thank you for being here today.
Thanks for having me back.
I see the blue, you have it all on your outfit and you have it on your top as well. Why are you wearing blue today?
Because it's Colorectal Awareness Month.
Okay, and so talk about that. Why is it so important that we raise awareness about Colorectal Awareness Month?
So colorectal cancer is the third leading cancer killer in both men and women. And it's very important that we are aware of it. And detecting colorectal cancer early saves lives. The earlier you detect cancer, any cancer, the better off your chances of living longer and curing that cancer. So therefore, we need to be aware and raise that awareness.
Okay, and so I want to talk about it. It's something, some folks consider a taboo and, maybe they don't want to talk about it, but we need to. When should folks start getting tested for this?
Great question, because at one time, a year ago, 2 years ago, we'd have said, oh, don't worry, you don't have to get tested until you're 50. Well, guess what? They've just lowered that, and now the age is 45.
Wow.
So if you were born before 1980, you now need to get tested.
Okay,
Yes.
and so is that 45 across the board for everybody?
Great question. So that is if you don't really have any first-degree relatives or don't have any other major risk factors, you should get tested at age 45. What if you have, say, a father who was diagnosed at age 45? Well, you may want to get tested at age 40 or even younger. Or if you have other hereditary risk factors. So not everyone should get tested at 45. You should get tested earlier if you have other risk factors. So talk to your primary care doctor and ask them if you have any other risk factors. But if you don't, then you should start screening at age 45. And the reason is that we're finding that the age of diagnosis is going younger and younger and younger. Not quite sure why it is, but therefore we're lowering the screening age to age 45.
All right, and how does Macon stack up in the grand scheme of all of this?
Great question. How does Georgia stack up against the rest of the nation?
Right.
And the answer to that is that colorectal cancer rates in Georgia tend to be higher than the national average. So we do have a bit of a colorectal problem here in the state of Georgia, and indeed we do need to make sure we get screenings done because the incidence of colorectal cancer in Georgia is slightly higher, and therefore getting screenings done and identifying it earlier will help save lives right here in Middle Georgia.
All right, and what resources does Atrium offer? How can you help out folks in Middle Georgia?
Great question. So one of the things we've just recently introduced is if you go online and go to our website, we actually have a tool that patients can log on to and look at maybe their risk factors and see when perhaps they should screen or help them determine whether or not they're at risk and when they can determine when they should start screening and have that conversation with their doctor. They can also look at our doctors online to see our GI doctors and who does colon screenings at our institution. So that's some of the things that they can go online and look at and see where they can get screened.
All right, and all of those resources, we will have a link to all of that on our website, 41nbc.com, to find out more as we talk and continue the conversation about colorectal cancer awareness. Thank you so much for being here today.
Well, thanks for having us. Yeah.